Good morning, and I add my welcome. In high-performing organizations, strategy drives well-coordinated action, and well-orchestrated action is what drives results. And I think that's what we're all here about together. Results in improved patient outcomes, in reaching communities who have limited access to behavioral health, social service, and healthcare services, and the outcomes of creating thriving communities across our region. For many of us, our entree into virtual care was that fortuitous day with the empty waiting rooms all around our country. I remember we were on site in a federally qualified health center in Vermont when the medical director turned to Christian, looking at a completely vacant waiting room at 10 o'clock in the morning, and said, "How fast can you get virtual care going?" And by Friday, we had implemented virtual care across all 7 sites with all providers, with good workflows and policies, super training. And by the next week, they were back at 70% of their daily volume. But for many of us, March 2020, the strategy was survival. Because no care was not an option. Our patients, our clients, our communities were counting on us to be there for them. And so for many organizations, the strategy was any care, even if we've never done it this way, is better than no care. We wanted to start off the conference by having you think throughout the 2 days about your why. What is it that you're seeking to accomplish with virtual care? Because strategy without execution is aimless, sort of wandering from idea to idea. And if we develop amazing strategies but don't implement them, it doesn't help those that we're trying to serve. So as John said, I'm Kathy Letendre. I've spent about half my career as a healthcare administrator, and my specialty is organizational excellence, helping organizations set ambitious visions and then put together the means to get there. Joined with Dell Anderson, the executive director of Renew, and also a member of the Thriving Together board, and my colleague Christian Milaster, who was born, raised, and educated in Germany, spent about a third of his career in Germany in software development and engineering, got his introduction to healthcare in the US at the Mayo Clinic in Rochester, Minnesota, and then launched Ingenium in 2012. So as you go throughout the 2 days, I want you to be asking yourself, what is our current strategy? It's not about survival anymore. It's about making virtual care or hybrid care a vital part of reaching our communities, and often those without other forms of access due to transportation challenges, lack of access to internet, and the like. So our roadmap for our remarks, we're going to spend some time highlighting the amazing work of Thriving Together and this regional strategy. Share what it's all about. Many of you here are a part of this work, but each of you, other than Wendy, are just a part of this strategy. And so we want to paint the picture of the full virtual care strategy across the North Central Washington region. And then Dell is going to share a case study from Renew about how they've put this into place with their strategic approach. And his team, during their breakout session, will share a lot more details about their implementation efforts. And then Christian will highlight some of the key elements to create virtual care that is optimal for the patient and the clinician. And then we'll kind of connect that back to some of the ways that you can go deeper during the conference. So we hope by setting the stage in this way, it will help you plan your route throughout the conference. There's so many choices, so many breakout sessions to choose from. And so hopefully this will whet your appetite in some things you want to go deeper in. As Wendy said, we encourage you to learn from each other, share your insights, share what's worked well, and how you can help others to advance their approach to virtual care. And we hope that you'll leave the conference with some clear next actions for your program, for your organization, and for those that you serve. We do work all around the country in virtual care and organizational excellence, and truly believe that what's happening here in this region is a novel approach. Thriving Together as a convener is really bringing together all parts of the community that sometimes work together and other times are somewhat competitive with each other, but creating a model where community partners are each doing what they do best. Clinical partners are advancing their skills and their tools, all in the service of the sanctity of that relationship between the patient and the clinician. So what is the driving strategy of virtual care as Thriving Together defines it? So the ultimate vision of this virtual care approach, spearheaded by Thriving Together, is that every resident can easily access all the care they need, where they need it, and when they need it. It's a pretty lofty vision, and we're making good progress in a couple years already. The strategy has 6 major components to it. One part of that are telehealth assessments. Another part of that is optimizing the telehealth services at interested clinical partners. The third are community-based access points, both for students in schools and patrons in our libraries. Really important then is expanding our reach and our services to serve more of our neighbors that have challenges in accessing our in-person services. The 5th part of this strategy is an impact study. And then the 6th part of this strategy is digital navigation and addressing the digital divide. So we're going to spend a little bit of time on each of these 6 strategies. So telehealth assessments, over a dozen organizations in the region, clinical partner organizations, have had a telehealth assessment as a place to start, to say, how ready is our telehealth program to serve our clients, our patients? And so across the different dozen or so organizations that have had a telehealth assessment, as you can see, a wide range of readiness for doing telehealth well. So some organizations started at that chaotic or emerging level in 2021 and have their sights set on becoming in that level of organizational maturity of supported and moving towards being able to use telehealth in a strategic way. And in the organizational assessments, each organization that chose to have an assessment walked away with clear guidance on how to move from whatever their starting point is to their future goal, whether that's to be integrated or using telehealth as a strategic tool. And then the next part of this strategy, as I mentioned, is around helping those clinical partners that are interested to improve their capabilities, whether that's community health centers, behavioral health clinics, community access or critical access hospitals, and addiction treatment centers. And in parallel, the community partners, the libraries and schools, the fire stations, Boys and Girls Club, getting involved to say, how can we be an access point for healthcare and social services in our communities? And North Central Washington Libraries has been one of those key partners with 28 library branches across the 4-county region. They established in their teleservices strategy an ambitious vision to be the welcoming heart in the communities where people can easily connect to a multitude of social and healthcare services. And another great partner in this endeavor, the NCESD and the school districts. With over 150 schools in the region, they established their virtual care strategy around minimizing disruptions to learning by being a place where both students and eventually staff and perhaps family members can use the schools as a place to access behavioral health, primary care, and other specialty services. And both the schools and the libraries developed sort of 5 strategic aims. First, to focus where the highest need is. Second, to use a coordinated approach, because there's only so much resource to go around. So by using a coordinated approach, we're not duplicating efforts, and we're using those scarce resources to the best of our abilities. Launching access points, which we're right in the middle of. Many of you are right in the thick of that. Getting those access points, the technology in place in the schools and the libraries. And then launching different teleservices, behavioral health, substance use disorder treatment, primary care, through those access points to the library patrons, to our existing clients in schools. And we fully believe, we've seen so many programs around the country, school-based telehealth, where it's sort of a build it and they will come philosophy, and we are certainly not proponents of that. And so Wendy is a big data person, as are we, and so the goal is really to monitor, to ensure that these services are being well utilized. So measuring and monitoring to make sure that we're serving and reaching the farthest reaches of your counties. And I think one of the really novel things about this approach is that it is what we call provider agnostic. Around the country, we so often see school-based telehealth is one provider setting up a telehealth service in a school. It's proprietary. It's a relationship between that school and that provider. And what we're building here is a really beautiful model where those access points can be used by any number of clinical providers that have patients or clients in that region. So clinical partner 1 may start by providing a behavioral health service through that access point, and another clinical partner may provide primary care services through that access point, and a third might provide specialty care services, perhaps pediatric endocrinology and the like. And clinical partner 2, let's say that's a family health center that provides both behavioral health and primary care services, can use that access point as well to serve their patients. And then the last part of this model is to provide some telesocial services. Because as John mentioned, the vital conditions of housing, food, a job, these dimensions of our lives have as much of an impact on our health and well-being as healthcare services. And so we're trialing this model in the libraries where we're seeking social service agencies in your region that are innovative and willing to try out the virtual delivery of some of their services. And so we'll be launching that first through the libraries. And we are looking for some interested social service agencies that want to be early adopters in that. Over the weekend, Three Rivers invited us up to the farmers market in Twisp, and we met a really interesting social service agency that is doing amazing work and may be interested in being an innovator with virtual delivery. The next part of this regional strategy is around optimization. As I mentioned, the assessments helped many clinical partners see where they were started, and many of those organizations said, we want to be better. We want to move from a coordinated level of telehealth to a strategic level. And so Dell Anderson is going to share how Renew has focused on their virtual care strategy and their leadership, and then Christian will talk about the other parts of the optimization approach.
Good morning. Yes, my bio is brief, and sometimes I feel like it's good to be brief, and sometimes it's uncomfortable to share some of the things that we do, but I want to really emphasize Renew and what Renew has done as an organization. The organization that I'm the executive director of, we provide all outpatient mental health services, all substance use outpatient services, as well as our developmental disabilities program, and we also have the 24-hour crisis system program as well. So it is a big system and a heavy lift, I would say, but also the staff that we have been awesome to work with and have really helped drive this work forward. I wanted to share briefly, as we're talking about leadership and governance, is that a few years ago I led our organization through rebranding. And during that rebranding, I organized the staff into groups that would help us get information from the staff. So through a series of about 40 hours of interviews, we had staff share some of the things that they would like to see in the program. And somebody came up with the phrase, innovate always, so I blame them. But I've loved that phrase. But we are trying to innovate always. And as we talk more in our meeting later today, in one of the breakout sessions, we'll get more into detail about that rebranding and the purpose and how that's led us into this direction. My personal thing about rebranding is when you rebrand, it's not a name. It's not just a change in colors or this logo that could be amazing. It's about, excuse me, it's about changing your internal culture, your name, likeness, image, and doing something different with your external culture so that the perceptions in the community can change, you can move in a different direction. My work experience that's led me personally to this is that I began my career in mental health as a case manager, and then I moved into a role as a therapist and a supervisor, and then I took on a role as a director of a behavioral health unit that was embedded inside a federally qualified health center. I spent 8 years there as the director of behavioral health at Tri-Cities Community Health over in Pasco, Washington. And as a part of that, I got to oversee the outpatient services, a detox facility, and also the integrated physical health and behavioral health medicine program. So as a part of that, we were able to incorporate and collaborate with physical health and learn how our work in behavioral health impacts the physical health excuse me, of those that we see. So as we move down this area of leadership, governance, and support and virtual strategy, I realized that through that rebranding process that we went through, we're going to need a team. That we're going to need a team that's going to help us govern inside the organization about what our virtual strategy is going to be. And then we need some focus on policies. One example is those national mandates that if you're on certain medications, you got to be seen in person once a year, and or for any updates. So we have to pay attention to what's coming and how to incorporate that into our virtual strategy. And so it was important to us to develop a team of individuals that would be representative of all of our different programs that could help lead us in that direction. Prior to this work, my experience with virtual care was setting up a way for behavioral health consultants to be reached for their physical health needs virtually. And I didn't foresee that virtual care would become a standard. I saw it as a portion of work that we could do to help create some additional access. So in addition to what we currently do. After leading our organization through this rebranding project, and we were approached by Thriving Together about doing a virtual assessment to see where we were on our technology, if there are any gaps, what it looked like. And to be transparent, I was reluctant. I was reluctant because I didn't yet see virtual care as a standard of practice, and I just led our organization through this huge project of rebranding. And also another project on top of that was that we are trying to move and transform our crisis team from only seeing people at the ER to seeing people in the homes, to seeing people at the library, at the park, on the bridge, going out with law enforcement and being on the streets with law enforcement. And so I was feeling like I've just moved our team through these huge projects. Is virtual care, is this the right time? And we moved through COVID, and I don't think we had a plan for COVID. It happened. And we just had to move, and we had to get people off site, and we had to provide services off site. But I don't think we had a good plan. I think it was just we let COVID dictate what we did as an organization, how we responded to the COVID situation. Different than healthcare. I think healthcare was ready and prepared for emergencies and ready for some of what would bring, but maybe not ready yet to have your staff off-site at home providing services. And so just a different process for us, and I felt that our staff could be overburdened. I felt that this wasn't the right time, so I actually put the project off for about 6 months. And then we circled back, and we moved back to this project because we have a phrase in our mission that says, innovate always. And if we are going to move forward as an organization, we're going to have to stay ahead of that curve, and we're going to have to move forward and some of those resources and new access opportunities so we can help our organization grow. So we were late in getting there, but once we got in, I can't tell you how helpful Ingenium has been as an organization, the support from Thriving Together, and that our team at Renew has bought in, and they've been awesome throughout this process. So as a part of this, we created what we are going to call at Renew our model of excellence in behavioral health and wellness. This starts similar to a home. We developed our mission, which is care for the whole person, be cohesive and kind, embrace change, grow hope, and innovate always. The roof of this house is our vision. Our vision is together we'll empower individuals toward recovery as healthy, contributing members of our communities. And then our values, commitment, equality, compassion, dignity, and respect. As a part of this strategic plan, we also had pillars that we have developed. And our first pillar is valuing our people, quality, service excellence, access, and then financial health. So as we took this model, we had to ask ourselves, how does this coordinate with virtual care? And as you'll see later today in our breakout session, we highlighted some of the terms and words that we feel like connected to virtual care. As a part of this presentation, we found that valuing our people, we cultivate an environment where staff feel valued, enjoy their work, and have opportunities for individual growth while exceeding performance expectations. We define quality as Renew, utilize innovation and best practices to ensure commitment to care that exceeds industry standards, leading to external recognition for our quality of services. Service excellence. Within our communities, we work as a cohesive team to provide outstanding customer service with kindness, compassion, and attentiveness to the needs of each individual. Access. Through innovation, we meet the evolving needs of our community. Through our county, Renew will ensure that our education, outreach, and services are accessible throughout our communities. And then financial health. Through proactive management of our internal processes, we create the financial means that allow us to expand the reach of our services. So this next slide will start to show how virtual care moves across each of these pillars. First, connected care experience excellence. Optimize the connected care experience for patients, counselors, and staff. Access through connected care services. Make it easier for patients to connect with their trusted behavioral health providers. And so as you can kind of see through the graph of where this project covers multiple pillars. Financial viability, utilize connected care services to increase revenue and productivity while also reducing costs. And then technological optimization, utilize existing and new technologies to optimize the delivery of services. As this project unfolded, we had to come up with what we were going to call this project, because this was going to be a new service line. If we're going to provide virtual care, it's got to be a new service. And so we decided as a team to call this our Connected Care program. And then we had to define what Connected Care is. Connected Care is caring for our clients at a distance. This includes interactive patient care, video, phone, and secure messaging. As a county entity in Grant County, the secure messaging's been really difficult for us because everything's open to public records disclosure or the Public Records Act. And so we've been trying to find ways that we can actually message our patient population in a secure way that's not public record. And so that's been a trial for us. But being able to do the phone visits and the video visits have worked really well. Our Connected Care mission, connecting individuals to personalized care at any location in our service area. And then Connected Care vision, through innovation, we will empower individuals toward recovery as healthy contributing members of our communities, independent of their location. So these are the things that were driving this strategy, is we tied it back to our original vision, which was that we'll empower individuals toward recovery as healthy contributing members of our communities. But to add this piece of our program, we want it to be independent of their location. So no matter where they live inside Grant County, we want to provide services that are accessible to them virtually, no matter where they are. And then as we move through this, we were able to do several projects. So what I realized through this strategy is once we have had a vision, a mission, and created this foundation for what we were going to do as an organization, and then Ingenium and Thriving Together helped support us in creating the technology and making sure we had all the equipment accessible to us to create a foundation, that we could start doing projects. So these projects that we're going to do, the first is telecrisis response. So the idea of this is to have telehealth equipment available inside our ERs across Grant County so that the providers there could access our crisis team 24 hours a day virtually. That's going to help tremendously in our area because from Mattawa to Grand Coulee, 3.5 to 4 hours. And sometimes we get caught with our designated crisis responder up in Grand Coulee and they have a call in Mattawa, or they're in Moses Lake and need to get to Grand Coulee quickly. And so we're really looking for those opportunities to help reduce time, help reduce those barriers, and make it possible for the medical providers to access our crisis team. The other project we're doing is the telehealth substance use services. One thing that we recognize through this is that we have several members of our smaller communities that drive all the way to Moses Lake for their intensive outpatient programming. And as I was sitting in a meeting, I realized that, wow, we have 7 to 10 people that are traveling this way, and our rooms are full, 4 group rooms. How do you provide a group virtually? And I was thinking you would just have them on the screen, it'd be okay, and you could provide that service. What I didn't realize is that the patient needs to feel that they're a part of the group even though they're off-site. And so then I learned about this cool thing called the owl that sits in the middle of the table, and it makes the individual that's off-site in the middle of the discussion. So they see whoever's talking, they see what's happening, and they are a part of what's occurring in the visit. So now, because we have this equipment, we're prepared to start offering our IOP services via telehealth. So the facilitator would be on site in Moses Lake with their group, but the other members and patients that need access to that service can now receive that service from their location. We're not yet at the point where they can do it from their home, but it's still going to be clinic-based. And so the idea there would be that the patient would come to the clinic, and then but the program would be facilitated by Moses Lake. We've been able to enhance several of our services through community-based access points. As we move through this process, it's interesting how quickly you can start to do projects because now the foundation's in place. Just to share just a brief example of that. On Friday, we were in a meeting, and we were talking about the projects that we're doing, and one individual in the meeting said, "What about the jails? We haven't done anything with the jails." And it's like, whoa, we hadn't even considered the jails yet, but that is a huge need. And it was a 15-minute conversation that led to somebody contacting somebody at the jail. I don't know the end point of that discussion yet or how quickly that can be offered, but that is how quick you can do something when this foundation is laid. When you have the equipment, you have a vision, mission, values guiding that strategy into this work, you can start to set up these programs, and then that really, the opportunity is endless for us to provide access across Grant County. Others of you in the region that have a more significant footprint to provide across regions. You see other organizations like BetterHelp, MD Live, that are doing telehealth medicine and doing these programs that are creating access nationwide for us. But as we're concentrated here in this region, this county, I think this is a great opportunity for all of us and has been a great benefit to us. Again, I want to thank our team at Renew for supporting these initiatives. It's been a big project. We've moved forward through this process. We're so grateful that our community is going to have access to services that they need. It's not perfect yet. We're striving, we're trying to get there, but it's made such a difference. And I again want to thank Thriving Together for their support through this, and also Ingenium for their leadership and their direction and guidance through this process as well. So I'm going to turn the time back over to Kathy. Thank you.
Thanks, Dell. Yeah, that I don't have all the final details on that jail project, but yeah, Trevor and I were meeting with the team, the virtual care steering team, when somebody said, we're doing telecrisis, our crisis responders are all prepared, we're ready, we know how to implement this in the ERs, let's look to the jails next. And I think we're hopeful to have that up and going by the end of next week, actually. So pretty amazing, because their organization is so ready to move, because they know that they're about doing what's best for each individual. In this case, an individual in crisis who would need to wait in a pretty dire holding cell until crisis could get there. So fingers crossed it will be up and going by the end of next week. And in strategy work, we're always looking for these things, what I call the bowling balls, those initiatives that knock down multiple pins, that telehealth service that allows an organization like Renew to advance each and every one of their 5 pillars. And I think, as Dell has illustrated, telehealth is one of those bowling balls. It allows you to improve access while focusing on improved clinical quality of care through continuity of services. It can certainly help with the financial productivity of an organization, and of course creates a great service experience for those who often lack access. And so with that, I'm going to turn it to Christian to talk about some of the other aspects of the optimization approach.
Great. Thank you very much, Kathy, and thank you very much, Dell. It's really great to be here. The needs of the patients are the only needs to be considered. That is a quote from one of the doctors, Mayo, that founded the Mayo Clinic. And I always get emotional when I say that, but as Kathy said, right, I started my healthcare journey in healthcare at the Mayo Clinic, and that really instilled this mindset that is really about the patient care. And what I got frustrated about as an engineer is that the clinicians don't have the tools and the processes and the workflow and the technology to make great decisions and to deliver great care. And so to come across a leader like Dell that invests in these opportunities to really lay the foundation upon which you then can really very quickly innovate and try out new ideas, that has been just very rewarding to work with this organization. So I don't know how much time we have left here, so I don't want to go too much here into detail, but at the core of this optimization framework, the idea is that you really lay the solid foundation upon which you then can plug in additional services. A lot of organizations don't want to invest that time. They want to launch something new, want to see the value, move on to the next thing. And this is laying it's a German engineer's approach, so have to admit it. In order to move fast, you sometimes got to move slow. You got to make that initial investment, and then you can build upon that. So really, this is a lot of the presentations here have elements of this honeycomb diagram, as you call it, in it. So as you go to the presentations, listen for that or ask questions of the speakers of how have you defined your workflows, your policies. So the other elements here are workflows and policies, right? That's what I said. Every system is perfectly designed to get the results it gets. So if you want to change the results, you got to change the system, and oftentimes it's the workflows, the policies, the technology, the training, the education, and so that is really at the core of the work is we do. We systematize and document and then train on the workflows. Obviously, you need to have great technology, but it's not about the technology. We're technology vendor agnostic, right? We don't care if you use Zoom. We recommend, again, WebEx and Teams, but other than that, you can do any video platform and make it work with the right workflows and the right training. But then also performance management. You saw that as the last element of NCSD and NCAA library strategies, right? We got to continuously measure the performance because otherwise people will backslide. And so that's, again, where leaders like Dell, it's important to look at the numbers, utilization, and identify the barriers. Nothing works without clinician engagement. I'll talk about this in the closing keynote tomorrow afternoon, right? To create a superb virtual care experience, we need to create a superb experience for the clinicians. If the clinicians are really feel supported and really understand where they can use virtual care and where virtual care is not appropriate, when they are really confident about using virtual care appropriately in their clinical practice, then patients will have a great experience and don't have to go to the NV Lives and Better Helps of the world, but can stay here regionally in the area, establish a relationship that when an in-person visit is needed, they can have it. You can't have an in-person visit with a Better Help counselor or with an MD Life clinician, right? Because they may be in Kansas, they may be even in Costa Rica, right? For all we care, as long as they're licensed here. So that is the fragmentation of care. And then last but not least, it's the marketing. It's the internal marketing, promoting it internally, what we're doing. So this is kind of the framework that we are using in order to help organizations to build that solid foundation upon which they can then always innovate and come up with new ideas, really try them out because they've got the workflows, they've got the technology, and they've been through this process now with the existing services and can launch new services. And this is just a Gantt chart of how we're moving with organizations through that. So, so again, this is about building the foundation, and then kind of with this. So this is what we covered so far here, and what we've been working on. And this telehealth expansion, the jail is one example. The crisis is another example. Tele-SUD, and there's other. We're looking at no-show rates and converting no-shows and cancellations into virtual care visits. Right. So just a lot of interesting ideas to leverage virtual care to achieve each of your missions of really delivering, serving your patients and delivering great care and giving them access even though they can't travel to you in person. The impact assessment, which the next keynote will be about, is really about holding ourselves accountable to what is the impact that we're making. Thriving Together has made a significant investment here through the HCA. You all have made a significant investment, and we really want to demonstrate and also measure what is the impact in the region, but then also knowing, and that's why we're doing an interim assessment by the end of the year, early next year, what do we have still left to do where we need to refocus our efforts. So again, data-driven decision making is very key. And then it's also very key with the the Tech Alliance, and I think we have got a slide coming up here on that. Right, it's really key that we have digital navigators. It's about digital literacy. It's about having equipment and having connectivity, and those school-based services, but especially the library-based access points, are really about compensating for that lack of access or lack of digital literacy by making it easy for people to just sit down in a video booth and have a virtual care visit or have access to telesocial services. So here are just some of the things that we already mentioned, right? I'll let you read and zoom in on some of the bullets here, but this is what really this kind of a lot of activity over the last 2-3 months here. That's what it allows us to do, to work with the organizations who were already very mature or who were brought up to that high level of maturity in order to use telehealth, if you remember from the maturity chart, to use telehealth in a strategic way, and then ultimately really in a transformative way. I already heard some ideas, Dell didn't talk about them, how Dell is thinking ahead, how we can really leverage, how he can leverage virtual care for the Renew to really transform the organization in a very different way that previously was not possible. And that's what virtual care really allows you, because it's not going away, it's not going back. With that, I'll hand it back to Kathy. Thank
Great,
you.
thanks, Christian. Excellent. So we've talked about the assessment part of the strategy and the optimization part. We've talked about the community-based school and library strategies, and then the expansion projects. And I do want to also add a thanks to for the grant funding to take on so many of those expansion projects in 90 days' time. It's a long list. I think it's been 50 projects in 90 days. Really amazing partnerships throughout the 4 counties to make all that happen. And as Christian mentioned, the next part of the strategy is the impact study. And Jason, my colleague here, will be talking about that just after lunch. 3-phased approach, a baseline assessment, an interim assessment, and then a final assessment in a couple years' time, focused on these key research questions. Why do people use telehealth? Why do they not use telehealth? What are the most common behavioral health and physical health conditions that are treated using telehealth? And Jason, as an amazing researcher, can show the compare and contrast between national and regional uses and effectiveness, as well as cost effectiveness of telehealth, virtual, hybrid services, and in person. And then lastly, what are some of the major barriers to adoption? And this study is really helping guide the work for the remaining few years of this project. And then last but certainly not least, the 6th strategy in this regional approach is around bridging the digital divide. And this incredible coalition that has come together between Thriving Together, the Tech Alliance, and other coalition partners to break down barriers to access, whether that's through library-based services for individuals who have transportation challenges or digital skill deficits, or through providing individuals with devices and minutes to be able to connect with their trusted providers. So digital navigation is that very last part of a really important part of this regional approach. And with that, we hope that you're getting a really good understanding of the part of this strategy that you've been a part of and parts of this regional-wide innovative approach that you might want to be a part of going forward. And so many of the workshops that Wendy has organized allows you to dive deeper into any aspects of this. So for instance, the Family Health Center's presentation will focus on some of the things they learned from the assessment and their optimization. The libraries talk tomorrow, and the schools really delving deeper into those community-based programs. The center and Catholic Charities sharing some of their expansion efforts. Jason's presentation on the impact study, the digital equity breakout session just after this. So many different ways to learn, collaborate, and share with others. And the last thing I'll mention is if you walk away from this conference and say, I'd like to get involved, I'd like to get more involved, or I have a social service agency that I'd like to have involved. We have these postcards around the room with Wendy's contact number on it. So if there's any part of this that you'd like to get more involved in, or you know of another partner organization who could really benefit from the funding, honestly, the support, the expertise to do this well, take some postcards and share those. And Wendy will be the conduit to connect you with the resources to get started. And so with that, I hope that you'll leave the 2 days with greater clarity around what next. Our virtual care strategy is no longer about survival, but about something so much more. So hope you'll leave with greater clarity around what is your next strategy, your virtual care 3.0 strategy. That you'll use that strategy as Dell's team has done to drive so many initiatives and actions, making sure that it's working for your community, your patients, your clinicians, and taking action. And so one of those actions might be reaching out to get some support, to talk it through with someone who's a little bit further ahead on the roadmap, or to secure expertise or funding or technology support to make it all happen. So we thank you for being here. We thank you for your work. If you'd like to connect with any of us, those QR codes will get you to connect with us and more information. And have a great couple of days. We look forward to hearing your stories, your experiences, and we thank you for creating thriving communities throughout the region.